Happy Monday, everybody. I hope you're all well, wherever you are in the world. I wanted to talk about quite a few things, really. The first thing is tamoxifen. I am finding it really, really difficult to be on the drug, which is a cancer treatment drug, and you're usually given it for 5 years, 5 to 10 years. I will be initially on it for 5 years. Most people refuse to take it, and the side effects are horrific. So the side effects are really, really bad. So I just wanted to say, for me, the side effects are bad, but also the things that I take normally, natural things like herbs and all of that, and herbal teas, etc., I cannot take while I'm using tamoxifen because it stops the tamoxifen drug from working. And so as a result, my fibromyalgia is flaring up. Now, many years ago, I had arthritis starting in my two thumbs, and then it went completely, disappeared, absolutely. I had it really sore, and my mum has it there and there as well. Me and mum are identical when it comes to medical stuff. So there and there, and that has flared up again. Now, when I talk to other women on tamoxifen, or I go on to different groups, the big thing that, the big side effect that wouldn't necessarily be mentioned, like the biggest side effect that's mentioned if you kind of Google or, you kind of go on to the website for tamoxifen or whatever, they would say things like uterine cancer, eye difficulties, like the retina detaching, like there's quite a few things that they talk about. But when I talk to women as one-to-one, or when I go on to different groups, the big side effect is pain, bone pain, muscle pain, joint pain. And my big side effect is, which I have anyway, is indigestion. So I've got really bad indigestion. And on Friday and Saturday, I actually thought I was coming off it completely. I just said, that's it. I'm not even saying anything to the doctor. I'm just coming off it. It was unbearable. Now, I'm on medication for indigestion, but I don't like to take it because that affects your bones, right? Bone density. So my doctor did say to me, well, would you prefer osteoporosis or stomach cancer, right? Genuinely. And she kind of, and I, it's fact. She's not saying anything that's wrong. It's actual fact. So the acid is so bad, and it's only when it's really, really bad I will take a tablet. And but I'm sure the damage is done. It's not good for your stomach to be constantly exposed, or your esophagus or whatever. And in my case, I always regurgitate my food. So, people actually on tamoxifen vomit. I don't actually vomit, but if I bend over, my food does come up into my mouth. And that is sorry, but I get sick into my mouth all day. That's not good. So, it's just what do you do? Really is the thing. What do you do? Do you take it and damage other parts of your body? Which my womb, last time I got it checked after I had started taking tamoxifen, I had a bleed, and I did go to a consultant, and he said that it's not very concerning, but the wall of my womb has thickened. And I mean, that was only after a couple of months on tamoxifen, whether it was because of tamoxifen or that was just happening anyway, which is not a good thing, really. That's, I think, how you get cancer of the womb. So you've got cancer of the womb, you've got retina issues, you've got hair thinning, all of that. I don't mind the hair thinning. I don't want to go blind. I don't want to end up with womb cancer. I don't want to end up with joint issues and bone issues that are irreparable and they don't, you know, you can't fix them afterwards or whatever, you know. You really, well, I really have to think about all this. And I just want to also say, because I get a lot of people contacting me who have different types of breast cancer. And this tamoxifen would only be for people, I think, with breast cancer, actually. I think it only stops estrogen going into your breast, you know, or reproducing in your breast. And so I am literally speaking to all these wonderful women who have come through breast cancer, have breast cancer, have gone through treatment or waiting on treatment or whatever. And, you know, some of them are on tamoxifen, some of them don't need it because some of them are not estrogen positive. Some are, you know, HE or negative, and there's all these different types. And when people contact me with their type of cancer, I genuinely sometimes have to Google what their actual cancer is, because I don't know. It's so new to me and I'm learning so much. But so some people don't need it, but I just want to say this, that the type of cancer that I have was, you know, as I said, stage 1, only in one place. So grade 1, stage 1. Not, that does not mean it's not going to come back. That does not mean it's not going to spread. That doesn't mean anything. They did take out the lump. I had a lumpectomy and the margins were clear mostly. And then there was an area they couldn't get to. So we don't know. That's where the radiotherapy came in, and they were hoping that would completely clear up anything if there was anything left. I chose not to do radiotherapy. So have I left cancer in there? You know, that's going to grow away and start going in different directions and attaching to other places. I don't know. It's a risk I took. And I felt, you know, at the time, and still feel, that the risks of the actual radiotherapy in my case way outweigh the benefits, right? So I'm hoping, living in hope, that my, you know, they got all the cancer, it's gone, and that's it, and it's done and dusted. The other thing that happened to me was I got a marker in my breast, and that marker was for when they did surgery, and I flipped out when they were putting in this marker, and titanium, okay, and I said I didn't want it. They said, well, you kind of have to have it. So when they took out a sample to see, you know, to check the cells, they at the same time put this marker in. So it's a breast marker, and that's fine. So that's for when they do another scan and all of that. But I was told that marker will come out when I have surgery. That's fine. I mean, if it hadn't have been cancer, it wouldn't have been removed. But the fact then it was cancer. So then I was called in to put in a second marker. There's a name for that, I can't remember, but it's one that flashes when they're, you know, operating or whatever. And that they're removed after surgery. I just want to show you Teddy. Say hello, Teddy. Hi. Teddy got his hair cut today. Oh my goodness. Go on down. Okay, so Teddy got his hair cut, and then he was also at the vet to get his anal glands emptied, and the vet said he'd never experienced that before. It actually went all over the wall, so they were very full. I knew there was something not right with them, and usually, excuse me, if Teddy's in a lot of pain, shaky and panting a lot, I know he's in pain, and 9 times out of 10 it's his anal glands, and his fill up pretty quick, don't know why. Anyway, besides Teddy and his anal glands, recently I went for a shoulder x-ray, and the guy, the consultant, what was he, the not osteopath, anyway, the orthopedic surgeon, he said that there were 4 markers. So I've got 4 markers. And when I don't know what they're from. Like, they removed 2 apparently, and I was told I'll never have markers again. I didn't want markers inside me. Now I've got 4 bits of titanium inside me, and they're like 1, 2, 3, 4. That's how they were. Anyway, so, but because my cancer was the type of cancer I had, I didn't have to think about doing, you know, I didn't have to do chemo and all of that. They did remove lymph nodes, and thanks be to God, there was no cancer in the lymph nodes. And so that's why I've been doing what I've been doing, right? And that's why now I'm almost going, do I really want to go through 5 years of feeling like this? I've put on a lot of weight. I can't walk very well. My mobility is really compromised. I'm in an awful lot of pain. I'm not sleeping, which is that's kind of normal for me. But I'm literally, oh my goodness, Teddy. Hold on, I have to pause this. Okay, I'm back. Sorry, I had to let Teddy out to the toilet. And I had actually paused it and thought I was doing something like pausing. Very professional, and it didn't work. Anyway, so basically, I don't know whether to continue my tamoxifen. I would love to know if people would, you know, talk to me about their experiences with the tamoxifen. And did they stay on it for 5 years? Did they, you know, did they come off it? Did you take it? Did you not take it? Did you refuse it? Did you try it and then it didn't work? Did you try it and it was fine? And did you try it? It was really difficult, but you stayed on it anyway. What are your experiences of tamoxifen? You know, I just don't know if it's worth it. I don't know if, you know, I don't know if the weight gain is something to do with it. I know weight gain is something to do with menopause, and now I'm totally in forced menopause, and it's very strange because I'm eating, you know, but I'm not eating loads and loads, and but I'm not moving a lot. I can't move as much. I really wonder if there was a gym beside me and I could do aquafit and I could do a few bits and pieces, Zumba or something, and I could literally fly to the gym and, you know, and do a class a day or something. Would that shift it for me? I don't know. So basically, anyway, what I'm trying to say is, please give me your experience if you have it, if you know of somebody who is on tamoxifen, if you have heard about it, if you're medical and you know about it, if you know, have heard about it and you're going, oh, absolutely not. I just want to know, or, you know, if you have knowledge and you think that, you know, it doesn't really make a difference. The other thing, I really do want to talk to my oncologist about this, is because, like, I think my breast cancer surgeon doesn't think I'm in menopause or was in menopause, but like, I genuinely think I was 3 years in to menopause. Like, that's just me. And so if I am in that, I don't see why I would need to stop estrogen going into my breasts if I'm in menopause. Like, why? I wouldn't have estrogen. I wouldn't be producing estrogen, number one. And number two, I was on HRT and I was putting lots of estrogen gel on my arms every night. I was doing 4 or 5 pumps a night, and that's a lot to anyone who knows. And so I've taken that away now. So I'm not putting HRT on me. I'm not putting all that estrogen inside me or on top of me, you know, that's going into my body. So if I've taken that estrogen away, is that not enough, you know, for me not to be not to be producing estrogen or having estrogen in my body? I think we produce it forever, really, I think, because I know some people who are actually in their 70s and everything and get breast cancer, they have these estrogen inhibitors for some reason. I don't know the the whole thing about it. So if you know about it and you have some idea, please tell me. I'd love to know. So I've stopped my HRT, so there's no estrogen going onto my body. I'm in menopause. So do I need to really use tamoxifen? Like, is it just an extra? Maybe. I have contacted my oncologist. I called the secretary, and the oncologist is lovely, but I called the secretary and asked could the oncologist contact me. And it was actually about a massage. Could I do a certain massage? And I've heard nothing back. I've called the breast clinic, heard nothing back. So I've no one really to talk to. So I'm kind of going, well, if my oncologist won't contact me, my breast clinic won't contact me, I don't really know where else to go. I can go to Maggie's, and that is a thing. They sometimes would suggest that I contact my breast cancer nurse. She does contact me an odd time. She would get back to me, but she's not very nice. Like, everyone is so lovely, but she's just not that nice. When I told her I'd found another lump, she said, well, that obviously can't be cancer. That absolutely can't be cancer. It's too soon, and call us in a month. I just felt a little bit kind of hurt or embarrassed or something by talking to her. I never have felt comfortable. She in fact made me cry when I was in the hospital going for my pre-op operation, a pre-op consultation. I was with this lovely nurse, and my breast surgeon had moved my date of my surgery, and my breast cancer nurse went insane. I mean, she was so angry at the breast surgeon and the whole situation, and how the nurses weren't informed, and they couldn't stop me crying, because I was just very emotional, because I had somebody set to my cat and my dog, and somebody to stay with me after the surgery and all that. So I just find this bit of kind of, they've done their job. You've been diagnosed. They've done their job. They've done whatever they feel is the right treatment, and now see you in a year. And I'm left kind of going, but I don't know if this suits me. I actually want to know what exactly tamoxifen is, what exactly, if I stop it, if I don't stop it, or, I just don't really, I just would like some information. So if anyone has some, bar me looking it up, I have a little booklet on it and all of that. But if anyone really knows more, or just feels the same, or feels that they're a bit frustrated as well with their information they're getting, or, just that follow-up information, or the follow-up advice, or follow-up kind of, you're just left in limbo for a year of like, I don't know. So anyway, that's enough, and I'll talk to you soon. Take care. Bye.